Yes.
All right, we're live. Good morning, everyone.
Good morning, everyone.
Good morning.
Great to see you all today.
We're really excited today. We've got an amazing special guest joining all the way from Cancun, Mexico. And but if you want to drop a note in the chat and tell us where you're joining from, we'd love to know. And hope you guys are doing well this morning.
And Linda's joining. Where are you joining from, Linda?
Well, I'm in Tennessee. I'm very close to John, visiting my son John in Dayton, Tennessee. So it is amazing to be able to do that. So we have a few more.
If you hear the train blowing through, it's going to hit two microphones at once. But we'll try to mute as the train comes through. So.
Okay.
It'll be fine. So, well, if you guys know, we've got a special guest. I'm sure you've seen. We've got a lot of excitement about today, and kind of wrapping up our series this month on Breast Cancer Awareness Month. So we're really excited to hear what Dr. Tony has. But we'll wait just a minute while people are joining. I'll go ahead and read our disclaimer. So since we are the WAVwatch, we offer low-risk acoustical frequency products that promote self-care and help to maintain or encourage good health and reduce the impact or risk of some chronic diseases, where self-care has been shown to play an important role in improving quality of life. The WAVwatch is not intended to diagnose, treat, cure, or prevent any disease or medical condition. It is not a licensed medical product, and all acoustic frequencies are considered experimental. WAVwatch is not FDA approved or considered a medical device, and any testimonies are voluntary and no one has been reimbursed for their testimony. The WAVwatch website refers to the commonly used names of disease only in relation to their sound frequencies and is not a medical diagnosis. All right, so today we've got our guest, Dr. Tony. So we're going to have a wonderful interview with him. Linda's going to do that. And then at the end of the webinar, we're going to have a giveaway. Actually, we've got 3 giveaways. 2 we're announcing from last week. And then last week, we may have a special offer for y'all. So we'll do the giveaway and the special offer at the end, just so you guys know. And yeah, I think we're ready. We've got a lot of people on, and it's looking good. John?
All right. So I know you guys can all read on your screen. I'm going to read something else a little bit, but I just want to say I got a request through our affiliate system, and I heard about this guy named Dr. Tony, and we finally got to meet via Zoom. We still haven't actually met in person, but we've got to meet a few times via Zoom. And I just, even though I've not been in the same room with him yet, you just get this feeling about people. You just know, and there's a genuineness and a love for others and a love for health that is very evident even through a video screen here. So I'm going to read his bio, but that was my little pre-bio, and that I'm really delighted to be to know you, Tony, and to look forward to being able to work together more. So Dr. Antonio Jimenez, MD, ND, is the founder and chief medical officer of the Hope for Cancer Treatment Centers, a world leader at the frontier of integrative oncology, with locations in Tijuana and Cancun, Mexico. At Hope for Cancer, Dr. Jimenez leads a team of over 200 employees, including over 25 MD physicians. For more than 30 years, Dr. Jimenez has dedicated his life to the study, clinical research, and implementation of the integrative strategies to treat cancer, chronic infections, and immune disorders. He has positioned Hope for Cancer as the world leader in many revolutionary treatments, including sonophotodynamic therapy, MAF bioimmunotherapy, Salvus bioimmunotherapy, and many others. He's affectionately known by his patients and colleagues simply as Dr. Tony. Dr. Jimenez is one of the most trusted voices in the world of integrative cancer therapy today. His 7 key principles of cancer therapy, the basis for his comprehensive integrative protocols, are discussed in detail in his highly acclaimed book, Hope for Cancer: 7 Principles to Remove Fear and Empower Your Healing Journey. Dr. Jimenez and Hope for Cancer are heavily featured in the docuseries created by the Truth About Cancer organization, which was watched by millions across the world. The same organization awarded him their Lifetime Achievement Award in 2016. Dr. Jimenez is one of 7 physicians worldwide certified to treat patients with the Gonzalez protocol. He is known as an avid educator who has shared his wisdom with large audiences in dozens of countries across the world through various media, including his free Dr. Tony's Integrative Healing webinar series, which has featured his wisdom every month for the past 4 years. And today he's here with us. So I'd like to introduce Dr. Tony.
All right. Welcome, Dr. Tony.
Dr. Tony.
Thank you so much. Hello.
Hello.
Thank you so much, John, and the Bamber family, and of course, the WAVwatch community. I'm so grateful and thankful to have this opportunity to share a little bit of what's going on in the world and at Hope for Cancer with breast cancer, because indeed it's worrisome. The increase of breast cancer incidence in the U.S. and around the world is significantly increasing. I have data that was published a few years ago from the Journal of the American Medical Association, JAMA, a peer-reviewed publication, and it says that evidence from the U.S. National Cancer Institute, the NCI, and this is the cream of the crop, the gold standard in data and so forth. And they said that from 1976 to 2009, there was a significant increase in breast cancer in younger patients. Yes. Imagine now in 2024, that's even greater. It's grown exponentially. 40%, Linda, and everyone watching, 40% of our cancer patients here are breast cancer patients. And what are we seeing now in this time? We're seeing younger patients. So this publication that was came out in 2010 by JAMA, Journal of American Medical Association, we're living it, and we're living it even to an nth degree. It's and not only breast cancer, I must say, all cancers we're seeing in younger patients more than ever before. As John said, I've been doing this for a long time. It's been over 30 years now, but we're still, we're still young, right? Everyone, right? So yes, it's very worrisome. Looking at other statistics put out by the American Cancer Society, 1 in every 8 women in the U.S. will be diagnosed with invasive breast cancer, one of the most aggressive cancers, and 1 in 39 will die from breast cancer. And this was in 2019, the last data. So the lifetime risk of being diagnosed or dying from breast cancer is significant. So what does that mean? That means that this webinar, and it's something we need to, what you learned today, we need to implement it today, not mañana, as they say in Mexico, like tomorrow. We need to implement it today. We need to be proactive, and we'll talk a lot about that today. So thank you again, Linda, John, and Joseph, for this opportunity.
Yeah.
Thank you.
Great to see you. Sorry,
yes.
John and I are going to drop off, but the reason that Linda actually developed the WAVwatch is some of her own story. So we'll let her share that a little bit as well.
All right.
Absolutely. Thank you.
And some of you have heard my story, but so many of the women that really started with the WAVwatch were in my office because it's called BRAS, BRAS, Breast Research Awareness and Support. And so my mission for over 16 years has been to teach women some proactive things that they could do, just like you're saying, don't do it mañana. I was trying to teach them right on the spot some things that they do and send them home with a booklet. And the reason for that interest was because both my mother and sister had breast cancer about 6 months apart. And my doctors just wanted me to do a prophylactic mastectomy. And as a teacher, I'm looking at them and going, I can figure out something better than that, So I started bras and tried to continue my education just in a different way. I didn't teach middle school anymore. I taught women so that we could try to protect our breast cancer problems. And so these statistics are just jumping out at us, Dr. Tony, and it's so sad that we are having to deal with this. But I think one of the most important words that I use was empower. And I heard you say the same word. You want to empower women. So I just am so appreciative that you're going to share some ideas, because they're going to be so amazing. Your title was so strong. We want to learn how to be proactive and empowered with our breast cancer. So what do you think that you do the most, or what's your favorite tip to share? I know you have a whole book and, the 7 principles. Go ahead and let us know what you think the most important things are for women to work with and to do. And that can take the whole hour. I know that's a big question. So,
well, I'll highlight some of the factors that increase the risk of breast cancer and your health. And these are things that you could start today working on them. One is alcohol. Studies have shown by Dr. Daniel Amen from the Amen clinics in the U.S. He's a psychiatrist. He's done more brain scans than any person in the world. And he has found in his research that any alcohol increases the risk of 7 types of breast cancer. 7 types of cancer, and one of them being breast cancer. So alcohol and tobacco must be eliminated. Obesity, the obesity factor with metabolic syndrome, insulin resistance, and also will throw off your hormones, the estrogens and progesterone and so forth. Lack of exercise. Exercise is something that has been proven beyond a doubt that increases lifespan in all of us, and also increases improvement and overcoming breast cancer also. That's one thing that has been proven without a shadow of a doubt. So let's start, exercising. The more we move, the healthier we will be. I always tell our patients, move, 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 move. A body in motion is a body that can get healthy and overcome any disease. And secondly, it's interesting that birth control pills, also, if you have a history of birth control pills, that can also increase your risk of breast cancer. So you need to be monitored closely. Implants, I did a little session on breast implants a couple of weeks ago for Breast Awareness Month. And implants are quite something that is directly related to increased risk of inflammation, autoimmune diseases, knocking down the immune system, and thus breast cancer and other cancers can be more prominent, and the incidence increases. If you have breastfed, then that helps you in decreasing the risk of breast cancer. So, for example, nuns have a higher incidence of breast cancer because they haven't had children, they haven't breastfed. Whereas people that have had more children, they have a lower risk of breast cancer, but then a higher risk of cervical uterine cancer. So these are tips that you could start now. As you said, Linda, my book, The 7 Key Principles of Cancer Therapy, goes very well with the WAVwatch, because I was looking at the 7 key principles, and then I looked at the manual, at your WAVwatch handbook and frequency guide. And then, this, like Linda said, these are long topics, but let me go over the 7 key principles of cancer therapy. And by the way, I call them the 7 key principles of cancer therapy because we are integrative oncology centers, but they're really the 7 key principles of health. Because for many years I thought, why should I do principle number 1, which is non-toxic cancer therapy? I don't have cancer, so why should I do that? But then I realized that we are all forming cancer cells every day. Some studies say that up to 100 cancer cells a day. So I now have done and am doing non-toxic cancer therapies myself, more for prevention, of course. And the second key principle is immunomodulation. The immune system will protect us from a cold to cancer and everything in between. And if you've had chemo or radiation or other therapies like the new targeted immunotherapies, which have a lot to be said about, they depress your immune system. So we have to upregulate our immune system. The third key principle is what the father of medicine said, Hippocrates, let food be thy medicine and medicine be thy food. So full spectrum nutrition. The next key principle is detoxification. Remember one thing, we should live a life of detoxification because we're exposed to toxicity from many avenues. The three major toxins that we're all exposed to are aluminum, glyphosate, and EMFs. And this is one thing I like about one of many things I like about the WAVwatch is that there's no EMF emissions. And this is why I do wear it, right? Because I wouldn't if there was EMF emissions. So detoxing is very, very important. Oxygenation. It was proven in the 40s, 50s by Otto Warburg that cancer is preferentially a low oxygen disease. So we have to oxygenate. What is the best way to oxygenate? Green, healthy foods, living foods. The closer we are to the garden, the healthier it is. That's why I branded the Garden Food Plan, which is part of our nutrition program, the Garden Food Plan. So the closer we are to the garden, the healthier we will be. The next key principle is restoring the microbiome. And I want you to think that mostly when we hear that, the microbiome, what do we think about? We think about the gut, right? The gut-brain connection. But it's the gut-everything connection. And the microbiome that's oftentimes missed is the oral dental microbiome. That means metal fillings have to be removed. That means cavitations. That's where a tooth was extracted, the gum sealed, but it left a pocket under the gum. That's called a cavitation. And oftentimes those harbor infection, germs, pathogens, and we need to clean that out. And then root canals. There is not ever, never, ever a healthy root canal tooth. That is clearly established by studies, animal studies, human studies, studies everywhere in the world. So root canal teeth, unfortunately, have to be extracted. There's no other option there. And then either you get a partial or you get a ceramic implant, not titanium, ceramic implant. And then the last, but most important, I think, of the 7 key principles is emotional and spiritual healing. And that will be the subject of my next book coming out in February, March of 2025, which is Emotions in Cancer. So please look out for that next year. And the reason I picked that of the 7 principles is for what I just said. You know, we heal first spiritually, emotionally, and then physically. We call that the downward causation of healing. If we have a triangle, we have our spiritual health, and then the emotional, mental, and then on the bottom is the physical. And of course, nowadays, medicine is upside down, and it's all about attacking the cancer in the patient. And that's it. It's not about working with the patient with the cancer, working on the spiritual, emotional, as well as the physical. So to piggyback that, Linda, on the WAVwatch manual, I was browsing through it, and you've covered all these 7 principles in the WAVwatch. On page 7 is detox, there is emotions, and then as we proceed, I love the solfeggio frequencies. These are healing and spiritual frequencies that have been proven for millennia that have such potent benefits, and you have them all here. Some of the benefits are on a physical level, and others are on a spiritual, emotional level. And then as we go on page 10, you start Linda talking about the sound frequencies for organs, right? So we could detox the gallbladder. We could detox the digestive system. It's all here. Kidneys, the skin, the biggest organ of elimination, right? It's here. Pain, which is one of the most common presenting symptoms in someone with cancer. Then you have pathogens. We talked about pathogens even in the dental area. You have immune support on page 17. So maybe we're brothers and sisters in another way, right? Because you piggyback those 7 key in the manual. And then you have a whole section on breast health, right? On breast health and hormones, which are very important. So, yeah, I've enjoyed the WAVwatch, and we'll talk a little bit more about that in a bit.
Well, I'm like you, Dr. Tony. When I, first heard about you, and of course, I have actually had someone who has been into my office, or I believe a couple women who have been to your clinic. And so I knew about your clinic, but when I really looked at your website in depth and saw your 7 principles, it's like, oh, wow, this is what I've been talking about. Everybody talks a little bit differently, but we are covering the same components. And I'm so glad that you talked about the teeth, because I've been teaching about teeth for 15 years. And I don't think my statistics have changed. 1 woman out of 100 will know that the teeth can affect their breast. That is just an unknown topic. They are not really realizing it. So that's one of the main things that I am teaching. And it is so important to realize all the problems with our teeth and the 8 teeth that connect to our breast health, So wouldn't that be something that we should have been taught years ago? It should be part of our basic knowledge about our health, is how dangerous our teeth can be to many areas of our body. So I just really appreciate you pointing that out again. So I don't know if I interrupted your train of thought there. We have so much to talk about.
Yes, I just want to talk a little bit more about teeth and dental health, because that's so important. Make sure that you go to a biological dentist, not a conventionally trained dentist, because removing the metal fillings in a not appropriate way can be even more detrimental than keeping your amalgam fillings, because then they'll seep into your system and go to different organs. So you need to go to a biological dentist. And we have vetted at Hope for Cancer Treatment Centers dentists in the US, in Canada, and other parts of the world. We have that list, and I think that we can make that available to your audience, Linda, if you would like. So these are biological dentists that we vetted in the US. Yeah, maybe we're missing some, but these are the ones that we vetted very carefully. I'm in the medical dental group in the US. So yeah, that's very important. And so one other tip, a good tip to go home with, is you need to floss, you need to rinse, you need to water pick, and you need to brush. And a quick rinse that you could make at home is, here's a recipe. You get a glass mason jar. You put 500 milliliters of distilled water. You put 2 teaspoons of baking soda. Make sure it's aluminum free and all that. And then you put ½ a cup of xylitol. That's a powder. Xylitol with an X. Xylitol. You could get that at health food stores or even on Amazon. And then you add 2 drops of any essential oils of your preference: peppermint, cinnamon, thyme, antibacterial or viral essential oils, clove, anything. You put 2 drops of each of them, and that should last you 2 weeks. And so then you make a new batch. And it's so healthy for the microbiome. It's antibacterial instead of using, those name brands that are full of toxins, and you don't want that in your mouth, your body.
It's huge. And I do thermography. So women have come in, Dr. Tony, with for thermograms, and we can see that they have a dental infection up here, and then we just see the trail go all the way down to the breast. So visually, women, we see that over and over again. And a lot of times that is what causes the breast cancer in men, is the dental also. And we have seen that in several men. So the picture's worth 1,000 words.
Yeah, that's a good point, Linda. We have thermography. All our patients get a thermography. And I don't know if any of you could see this, but I want to read it for you. This is thermograms versus mammograms. And the benefit of having a thermogram is that a thermogram can detect an abnormality in the breast 5 years before the lump presents itself, which is when the mammogram will show something. So a thermogram can detect abnormality when there's about 256 cells in that area. A mammogram is 268 million cells in that area. So from 256 cells, a thermogram will notice abnormality there, versus a mammogram, 268 million plus cells when the lump is already there. So mammograms, besides the toxicity and all that, when it detects a lump, it's not an early stage diagnosis. There already can be what's called circulating tumor cells. These are cells that have left the primary lump or bump or tumor nodule in the breast, and it's now circulating in the bloodstream. So thank you for that point there, Linda, because yes, thermograms are very important in not only the teeth, which is very important, but also breast health and earlier detection of some abnormalities so that you could be proactive immediately.
Yes, I love those. It made so much sense to me. And so many women that have breast cancer, like my own mother and sister, my mother had 30 some mammograms when she discovered her own breast cancer. So it really made you start questioning, what was the use of those, and then you learn more and more about them. And so I think women are starting to wake up. And so we do have several bras, basically businesses around the U.S. So there's about 12 of them. You can look us up on the internet, brasthermography.com, and or get thermograms other places. But hopefully, women, you will be realizing how important this is.
Yes, and on that note, Linda, and all the viewers, how should one assess breast health? Number one is don't do mammograms. What are your options? Your options are thermograms, as we just mentioned, thermography. Another option is an ultrasound. And then the third option is MRI to look deeper and more detailed. There is new technology that's called a QT ultrasound. This is a new technology. One of my friends, Dr. Jimenez, is one of the researchers and physicians behind this technology. She was a breast surgeon or is a breast surgeon, but she's more into earlier diagnosis. So her dream and the dream of the company is that in the near future, mammograms will be eliminated from hospitals and clinics and so forth, and they will have a QT ultrasound, which much more accurate and no toxicities, and the breasts are not smashed and any of that. So if you think you should have a mammogram and you do have breast implants, then they have to do a special technique called the ECLUD technique, EKLUND, and that will allow the radiologist to see beyond the implant of any abnormality. So just in case any of you are still in the mind frame of having to do a mammogram, if you have an implant, make sure that that technique is done so that they don't miss anything because of the implants.
That is such good information. And maybe as women, if we start using some of these other ideas more and more, that will help to, thin mammography out. After all, it's not even used in Europe anymore. If I'm understanding correctly, they do not use it. So we should be following suit, and your information is so good to know what else to do.
Yes, exactly right. And Switzerland is the country that's done the most studies on the dangers of thermography and the of mammograms and the benefits of thermography. However, Linda, the politics and the pharmaceutical companies and all that, it's not quite where we want it to be, even in Europe, but there is more awareness every day, as you mentioned. And this is part of why we're doing this amazing webinar with you, Linda, and to your community.
I just really appreciate your time. So one question I had was about gut health. So, you did mention that we have digestive issues on the WAVwatch and support for that. I guess what I really wanted to ask, if you have women with breast cancer, are you seeing that they've had leaky gut or, IBS or anything like that for years and years? Is there a connection that way?
Yes, 80% approximately of our breast cancer patients, and I would say cancer in general as well, have gut dysbiosis, gut fermentation, or gut petrification. And then we could call that leaky guts. And so that's why we have nutritionists. That's why we do really in-depth testing to know what is the best remedy, what is lacking, what is an excess, how the diet is, are they getting hydrated, anything that affects the gut health. Stress, for example, a good night's sleep versus a poor night's sleep. So absolutely, this is very common, Linda, is leaky gut, gut dysbiosis, gut fermentation, and poor digestion in our breast cancer patients. There is a lot of research, as you know, going on in that field. And the more we know, the less we know, because we only know a fraction of that microbiota. But, we know a lot more now than we did 30 years ago when I started all this. So that's a blessing. And the main things that one can do right away to improve your gut health is nutrition, right? Make sure you're going to the garden food diet, you're eliminating GMO foods, you're eliminating all processed sugars, you're eliminating also meats, beef and pork and that kind of thing. It's hard to digest. So the more as I said earlier, the closer you are to the garden, the better. And that means more fruits, more vegetables, some fish. We have the issue of, heavy metals with the fish, so we have to be careful with that. Full chicken that's healthy, no steroids, no antibiotic, free-range chicken, but beef and pork and those tougher foods to digest and assimilate, I would stop them for a while till your gut is better. And then remember, it's not only what we eat, but what we assimilate and what we eliminate. And that's what another thing I like about the WAVwatch is all the digestive frequencies that you have in there. And that I work on every day when I have the WAVwatch. I have two favorite files, and one is a more general one, and then the second one is more for digestion, for heavy metal detox, and I love those favorite files, right? Because you just set it, and you could do it on I call it rewind. It might not be the appropriate word, but you keep it on rewind, and it just continues to treat you. Yeah. Yes,
well,
yes.
I'm just there are so many things about this general wellness product, that you've kind of mentioned, and it's hard to have, a double-blind study, quote unquote. So when our viewers and users share ideas with us, it is so valuable. And I really didn't know how well the detoxification was working. But so that folder, when women play that, I have had feedback from a couple of people that used foot baths, the ion foot bath. and their water is always really dark when they use that, and they've used it, some of them, for years, and then they start using the WAVwatch and their water changes completely, and it's much lighter or just tea colored, or some changes like that. So to me, maybe I'm jumping to conclusions, but I kind of breathed a sigh of relief. Oh, there's a possibility that it is detoxing fairly well. We may not be seeing it in our stool or anything, but something is going on, and our bodies do seem to be cleaner when we play that detox. And then one more area there is blood cleansing. And I have showed this before, but we did have a microscopic look of someone's blood, and then they used blood cleansing, which is in a file, and then they took another picture with a microscopy, I guess I'm getting the right word here, and the blood was very much cleaner in 8 minutes. So to see what viewers have given us has been amazing. So I want to thank everybody for those ideas. And John, I don't know if you can, find that while we're waiting, maybe to show the blood microscopy picture that I was talking about, maybe at the very end, possibly. But anyway, what are some other things that you have really found out that women are not aware of that could be causing some of their breast problems?
Before I answer that, I want to say a little bit of my experience with the WAVwatch with respect to what you're mentioning. Is I have an Aura ring, which is a non-EMF emitting ring also, and it looks at your sleep, if you're in REM or deep, heart rate, like anything those dumb watches tell you, but this is without EMF. I said dumb instead of smart, right? Because they're not smart watches, they're dumb watches. But in the Aura ring, it measures your daytime stress, and it has 4 categories: stressed, engaged, relaxed, or restored. And what we're observing, we haven't done a clinical trial, this is just observation. What we're observing is when we're running the WAVwatch, we're more in the relaxed and restored area of the daytime stress than in the stressed or engaged, even if we are in a meeting or using our brain a lot at that moment, but it keeps us more in that relaxed and restored part of the graph. So that's interesting, and maybe some of your WAVwatch users can look at that and see if that's a consistent finding. But we have found that in a number of my friends and I that use the WAVwatch and have the Aura ring. So to answer your question, I think your question was it like factors that we need to know that can influence or the increase in breast cancer risk? Was that it, Linda?
Something along those lines. I've already, I'm laughing at myself too. Yeah, I think that's what I said. But,
so one is, know your family history. Linda mentioned her sister and her mom. So know your personal and family history. Personal, it means, are you living a lifestyle that increases your risk of developing breast cancer? And I mentioned them, right? Lack of exercise, smoking, drinking, not enough sleep, a lot of stress, unhealthy foods, and so forth. And then know your family history as well. Is there breast cancer in the family? But remember, we are not doomed by our family history. Only 2.5% of all cancers are truly genetic in nature. So even though Linda's telling us that her mother and her sister have breast cancer, that doesn't mean that you or your daughters are doomed, right? Because it's the epigenetics. What turns on that gene? What turns on that gene, that switch? What turns on that switch? When you enter a room, the lights are off, the switch can turn the lights on, right? Or not if you don't turn the switch on. And so the same thing with our genes. So we are not doomed by our genes. My father had prostate cancer, and I don't accept that for myself. I know that the things that I needed to change from his history, And so I'm doing it. So knowing the family history, the personal history is important. And then the environment, right? Are we exposed to radioactivity, EMF, spark meters, 5G? How are we mitigating those exposures? Are we turning our Wi-Fi off at night? We don't need it, right? Are we charging our phone next to our bed when we're sleeping 7, 8 hours a night? That's a no-no, right? So we need to make those little but big changes in our environment that can be very important. Are we grounding at night? So do you have a grounding sheet, a grounding pillowcase? Are you using your WAVwatch? And well, I want to say something now. As John said, I'm a naturopathic doctor as well. And in naturopathic medicine, we learn something called the therapeutic order of healing. And the first one is to remove obstacles to health or obstacles to cure. So remember that. And not only remember, let's start doing it today, not mañana. The second one is to strengthen weakened systems. What are the weakest systems? Is it your digestive system? Is it your respiratory system? Is it your immune system? Is it the emotional system, right? So what is your weakest system? So focus on that. And then you go to the next one in order of priorities, right? And then the other one is to work on postural posture, your posture, the integrity of your posture through chiropractor adjustments, acupuncture. If you're into, a good way of viewing yoga with, Christian music in the background and all that, we're a faith-based organization. Hope for Cancer is, and that's who we are. So yoga is okay, depending, how the concept is and what you're listening to when you're doing this. So all these areas that are so important for your posture. And then number 4 of the therapeutic order of healing is something that we always need to remember, is stimulating your body's self-healing mechanisms. Stimulating your body's self-healing mechanisms. We're not going to run to get an aspirin or a Tylenol. Why is that pain? Why is that inflammation? Your body can heal it, but we have to give it the right sound frequencies. We need to give it the right foods and nutrients and so forth. So that's very important. And then follow the 7 key principles to cancer, therapy to health. And that's really the foundation, right? It's not masking things, but researching, investigating, testing to see what's causing the pain, the inflammation. And you are your best doctor, your healer, right? And then you bring this to the medical doctor, hopefully a functional, integrative doctor that could look at the whole picture, not just a Band-Aid approach.
That is such amazing information that we all need to be doing for anybody, not just talking about breast cancer, but everybody needs to be taking this to heart. Now, one question I had was about the emotions, and maybe I'm speculating too much, but do you think our emotions are causing a greater cancer risk in this day and time, considering, some of our stress levels have changed dramatically? Is there any connection there, or can you speculate on maybe why our cancer rates have changed, or whatever in younger women?
Yeah, I'm going to go beyond guessing or thinking or speculating because we are in it. We're in it. We're seeing
Yes.
every day from many, many countries, right? We have patients currently, from 5, 7, 8 different countries here, all over the U.S. So it is very clear, Linda, and everyone, that the emotions are playing a key role in the higher incidence of cancer. I read recently that if you have to recommend to someone who doesn't know what field to go into for their career. They want long-term job security. They should go into mental health, because mental health needs are going to increase and already started to increase by 40% in the next few years. So greater mental health practitioners are being needed, and that's just increasing. So emotions are key in all this. And I could tell you in your community, Linda, many stories of how that happens. We know that melanoma is unpredictable. However, now she is not in fear, that word fear. And the other word that we both use, she's empowered now in many ways. And this is just one example of how emotions are directly correlated to the higher incidence in younger patients with cancer of all types, including breast cancer, pancreatic cancer, colon cancer, lymphoma is through the roof, brain tumors. We have a patient here, an attorney. She has a brain tumor, and her oncologist at home in the U.S. told her that the brain tumor, he believes, is directly correlated to the SARS-CoV-2 injection, because he has seen it over and over as a neurosurgeon, that the correlation between the two. So this is something else that we have to all detox from, is that spike protein.
So, and don't forget, that's on the detox folder. It's the very last one. Viral detox was my frequency set that I put together for hopefully detoxing, any jabs that you might have had. But I just think the information that you have on everything is phenomenal. And I hope every person listening will take this to heart and start working on something. Even if you just picked up one little idea today, you can make a phenomenal change in your life. And if you already have the WAVwatch, maybe run some more frequencies for emotions, because I put about 10% of the frequencies are emotional frequencies that are on the WAVwatch. That's the idea that I had, how important it was. And so it is have been such a pleasure to share with you. Our hour is almost up. So Joseph and John, I don't know if you want to come back on, but is there any last thing, maybe I should say, is there any last thing you'd like to summarize before we give away 3 watches and kind of close out?
We can take some questions too. We've got a few in the chat, so if that's okay.
Before anything else, Dr. Tony, if people are wondering a bit more about Hope for Cancer, where can they find you guys?
We can go to the website, hope4cancer.com, and you get a lot of information. You get the contact information to our admissions office. You get the link to our webinar. We do an educational webinar every month. Also, the next one, I think, Lisa, will be the 100th webinar. So we expect a big following that day. And thank you for that opportunity. Thank you again. I want to say one last thing, please. Maybe not the last thing, but I want to say one thing. What you have and what you can have on your wrist is so powerful. One of our therapies that we've been doing since 2002 is using sound therapy to target cancer cells. And sound therapy has anti-cancer benefits, antibacterial benefits, or viral infections. It also decreases blood flow into cancer cells. And very importantly, it upregulates the immune system. But guess what? On October 9th, 2023, the US FDA, remember those guys, the FDA, they awarded FDA clearance and approval to a company that this technique was studied at the University of Michigan, and they're calling histotripsy. It's using sound to affect liver tumors. So the title of this was Tumor Destroying Sound Waves Receive FDA Approval for Liver Treatment in Humans. And at Hope for Cancer, we've been doing this since 2002. And so it was like, a feather in our cap that finally, they're catching up. But that being said, we are using sound waves to treat cancers in many parts of the body, except the brain. So what you have and can have on your wrist with these sound frequencies and the wellness and everything there combines well with health, prevention, and just feeling optimal. I think that a lot of us think we feel the best we can, but we could feel better.
Yeah, absolutely. And I love, I was taking notes because you just have a wealth of knowledge and a lot of stuff that, isn't conventionally shared about alcohol, exercise, all that. And just a question for me, I've been hearing several people talk about mitochondria and your that root energy of your body. And we were at a seminar, I think 2 weeks ago, and they were talking about this zone 2 exercise, doing that 3 to 4 times a week, just really helps your mitochondria. Is that kind of related to what you shared about exercise?
Yeah, that was a little cut off, but we got cut off.
Oh, sorry.
Yeah,
you're good. I think that the internet's maybe just a little
I'm
slow.
back. So
it's okay. My question was about zone 2 exercise.
So regarding exercise, very, very important.
You're good.
Regarding exercise, very important. We don't have to run a marathon, but I'll leave you with a couple tips. One is aerobic exercises, 10 to 20 minutes, 3 days a week. Number 2 is flexibility. Flexibility and stretching is so important. And number 3 is lightweight resistance exercise with like cables or cords for strength training, which is very easy. They sell those power plates now that they come with the cables, and that's my favorite to do. So very low cost way to exercise. And then going with a positive mindset, be well hydrated. And if you're taking supplements, you could take the supplements before that. So yes, Joseph, I think I got the question. It got a little cut off.
No, that was perfect. And we've got a few questions in the chat. If that's okay, I'll just put them on the screen, and that's easier for you to probably see. And then we can move on into the giveaway in just a minute after we get some questions.
So, Dr. Tony, what about men's breast health? Are there more men getting breast cancer? I have not seen that. In the years of my work in oncology, I've seen few men with breast cancer. However, we do know that a man that gets breast cancer, it tends to be much more aggressive than a female with breast cancer. And so my recommendation for all of us men out there is that the risk is there, even though I have not seen this in a clinical setting, but we need to be aware of that. And I encourage you to consider having your hormones tested. And there's an epidemic.
We lost it. I can't hear.
Hello?
There.
Yeah, I think your internet went out for a minute, but
I think all of us were out. All of us
The
were out.
last word you said was there's an epidemic in regards to hormones, I believe. You said there's an epidemic.
Okay, yes. So hormone health is very important.
Well, Dr. Tony told us when they started that there was a storm, I guess, going on in Cancun too. So got two things.
Yeah.
But
well, while he's connecting, we can do a few things. We can do our giveaway, And then when
Oh,
he gets,
I love the comment too. This webinar is gold. So,
yeah, we had so many great comments on the webinar. So thank you so much, Dr. Tony. And when you reconnect, oh, you're back. All right. All right. You're back. And we were just going to move on to the giveaway, but I was going to show this that John had mentioned earlier about.
Am I back?
Yes, you're back. Yeah, we got you.
So one of our affiliates, Shelly Castellano.
Yeah. Apologies, everyone, for that.
No worries.
No problem.
We had found a picture that was referred to earlier in the talk, and then we'll get back to what we were talking about too, Tony. But this is an image that was sent by one of our affiliates, and it shows her blood with the rouleau on top, and then the bottom picture is after she ran the blood cleansing program on the WAVwatch. And so I cannot say that I am a scientist or doctor by trade, but I'm definitely interested in learning more about what's going on with this blood here. And it's been amazing hearing, just like Dr. Tony was saying, how different types of things have even been approved by the FDA, and looking what sound has done for these blood cells is pretty phenomenal too. So
I think, Dr. Tony, when you got cut off, you were talking about possible hormones with men causing problems with breast cancer.
Yeah. I think.
Yes, there is a pandemic now in men, even young men with very low testosterone, and this is not healthy because if the hormones are low, then our immune system is low. Our nervous system is in fight or flight, so we're sympathetic dominant. It's like the lion is chasing us every moment of every day. So please, everyone out there, 40 or above, or even younger men, should test your testosterone. The test that we recommend is something you could order yourself. It's called DutchTest.com is the website, Dutch, DUTCH test.com, and order the 24-hour male or female urine hormone test. That will tell us your estrogens, your progesterone, your thyroid, your cortisol levels, and also the testosterone. If your testosterone is low in men that we're talking about, we need to do a biosimilar testosterone. I use the cream myself. I'm only 25. No, we need to supplement because as we get younger, the testosterone gets lower. So we need to supplement.
And then I would just throw in,
and thus decreasing our risk of developing hormone-related.
And I would just like to add to that, to be careful of plastic. So many younger people are just drinking out of plastic bottles all day long, and those are hormone disruptors. So clean up your diet and what you're drinking out of, not just your diet itself, but all the toxins that could be going in and disrupting hormones. So.
Yeah, absolutely.
Absolutely, Linda. In those glass, the 16 ounce of a plastic water bottle has been found to have up to 400.
I think he froze again for a minute, but
400,000 particles in each bottle is what he was saying.
Wow.
Yes,
that's crazy. Well, we'll do the giveaway, and then let's move on to that. And so we've already taken some questions, but so we're going to give away 3 watches. The first one is for somebody live on this webinar. So what you want to do is follow us at WAVwatch on Facebook or Instagram, YouTube, or Pinterest, and also follow Hope for Cancer Mexico. That's their channel. And then comment in the chat your favorite takeaway from the webinar. So you need to just, comment something in the chat that was your favorite moment, and that's how we will randomly select a winner. So you guys can go ahead and follow us on social media and put a comment on the chat about your highlight. And then I also wanted to announce the winners from last week. We had a webinar last week where we took testimonials, and we were having some issues, so people could also submit online. And Sheila submitted, and actually, let me see if I have a way to share this. It was such a great video. We're already over time, but we'll be sharing this on our social media in the coming days on YouTube or Instagram. So
Thank you, Sheila.
yeah, so congratulations,
WAVwatch out
Sheila.
to you.
She had an amazing story about some hip pain from doing too much exercise and wore the watch and was able to walk much better the next day. So, and then our third giveaway was a written review. And so Melissa said she was skeptical at first, but I have a coworker who let me use the WAVwatch for the day. I was blown away. I have fibromyalgia and it works better than any pill I've tried. So
Wow.
thank you for everyone. Congrats, Melissa. Thank you so much. And thank you for everyone who wrote a comment on Facebook or on our website about your WAVwatch. So we'll go back to the winner for this webinar. So I'm just looking over here from all the people that have commented. Wow, lots of comments. Thank you, everybody. All right, 1, 2. I'm just going to pick a random number.
All right.
All right, so I picked this number, and so this is our random winner. So Kim Zimmer mentioned her takeaways about hormones and about the Dutch test. So Kim, congratulations, you're the winner. And so if you can send, I've got your email from registering for the webinar. So Kim, we'll get you connected by email and get it. So congratulations to all our winners. And last but not least is I know that Dr. Tony's still having some connection issues, but just for today, we are giving you guys some great special deals on the WAVwatch, and this is all going towards Hope for Cancer and their work. So that's they're our affiliate partner. So be sure to use the discount code Hope for Cancer if you don't have an affiliate code already. And then combining with our website, we're doing $125 off for 1 watch, $250 for 2, or $500 off for 3 watches, and then free U.S. shipping. So that's for today only. And thank you so much, everyone who joined. And John or Linda, any other thoughts?
Yeah, just want to say I was blown away, and Linda, thank you for sharing. And we were honored to have Dr. Tony and on the webinar today. And sad he had some connection issues at the end, but I hope that we can do some more with him. And we're just thankful for what he was able to bring to the table today. It was really amazing. So thank you all for joining us.
Thanks for your hearts of love, Kim. Congratulations on the WAVwatch.
And I'll drop a few chats, and then we'll try not to hide you, John. Let me flip. So just a few comments from people that were on today. The treatment pyramid is upside down. Work first on spiritual, then emotional, then physical. That's really, really fascinating.
You're very welcome, Jess. Glad to be bringing some content like this, and we hope to continue to. Every month we're trying to really bring something really special for you guys, and to continue to grow and learn more things in the same time. So thank you all.
Mm-hmm. Oh,
Perfect.
thanks, Kim.
And don't forget, it's hopeforcancer.com. Great website. And everybody knows somebody that might need his information. Yeah.
And so somebody asked about insurance. So not necessarily insurance, but you can pay for the WAVwatch with an HSA or FSA account. And I'll drop the link in the chat that explains that.
And they may have been talking about the warranty also. That is for breakage and water damage. And that is available online when you purchase the watch. You try to buy the warranty when you purchase it, like any warranty.
Wow, so many great comments. Oh yeah, and the replay. Okay, people are asking about the replay. That's I'll put.
I'm just prompting you, bro. I'm just prompting you, man.
Oh, you are. All right, so we always do replays on Rumble. So you can follow us on Rumble and then on our Facebook page, and as well as YouTube. So all those places are great places to watch the replay.
Oh, and we may have to get the list of biological dentists from Dr. Tony, and we will be sharing that with you. Yes.
Yeah, and lots of people were asking too about thermography clinics. There's several websites, but we can send that out as well. So, all right. And last thing wanted to say is some exciting stuff is happening for WAVwatch. So just stay tuned, follow us on social, and a webinar next week. We have some exciting announcements. So just stay tuned, and we're looking forward to sharing with you all some big news. So
Stay tuned. Yes. Thank you all.
All right.
My
Really
sons are
appreciate
calling
you
that a
listening.
teaser. So we put out a teaser. Hope we'll see you next week.
All right. Love you all.
Thanks.
Bye.
Bye-bye.